The project's origins, in a way, go back many years to 2006, 7, 8, somewhere in there, when I was asked to write a paper by a Canadian public health organization. Why does the government not do what the evidence says the government should do? And for a political scientist and a person who worked in government, this is a very odd question. And when I looked into it, I discovered that from a public health perspective, the question makes perfect sense. It assumes that policy generally and public health policy in particular is based primarily, or should be based primarily, on the evidence, which is not at all the way a political scientist would think. And as I looked into it, I discovered there was a small number of other people, other scholars, some in public health, some in political science, some in allied disciplines, who had confronted the very same question. And so we started into a sort of a conversation, as it were. So these are people in Australia, in the United Kingdom, elsewhere in Europe, some people in the United States. And it was this common pattern where political scientists find themselves giving workshops, writing for public health audiences, and there's this sort of process where you have to sensitize or explain that the role that scientific evidence does and does not play in the making of policy and public health policy in particular. So that was sort of the origins. And then at one point I got the idea, well, why don't we bring these people together in a workshop? And I got a bit of funding from the Canadian Institutes of Health Research to do that. And so the book has its origins, its more proximate origins, in a workshop held at York University in the offices of the Global Strategy Lab in the summer of 2019. So the book has its origins pre-pandemic. If it took this long to get it published, that is, again, surprise, surprise, one of the effects of the pandemic.